Hey guys, it's Almighty Quinn. I'm making a video tonight about the massage technique of skin rolling to reduce scars. Somebody in a support group in Denver asked what ways they can reduce scars. We're asking about many different things, and if we knew any massage therapists. I am a licensed massage therapist. I don't have a space or the time to practice right now, but I'm still a licensed massage therapist, so I figured I would make a video on the skin rolling technique. The number one thing to know is that you have to wait until you are completely healed to do this technique. It is designed to kind of break down some tissue and bring blood flow to the area, but if the tissue is still healing, it's going to break that down. It could even open it up and delay healing, open it up to infection, something like that. So don't do it. Wait until your scar is very healed. So basically, a little two and a half 2.5 years, something, after a while. So anyway, you can see my scars, that my doc did a really, really good job on scarring, you know. And so I haven't really done this technique. I'm pretty happy with my scars. I have done essential oils, vitamin E, big time on my scars when they were first healing and very pink. But what I'm going to show you tonight is a skin rolling technique. When I was learning it, I tend to call it the horse and buggy because that's what helped me remember the technique. So, it's showing in your hands, this is your horse, okay? No coconuts needed. If you want to do it, I won't judge you. This is your buggy, right? So basically what you're doing with your hand is you're dragging your buggy along with your horses, right? And you want to press the pressure with the horse, right? So you're dragging it along like this. If you can kind of see what I'm doing there. I don't know. So anyway, you can kind of see there. And you'll see that I'm leaving a little bit of mark here. So what you'll do is you'll go to your scar right here, right? And you just want to drag across it, right? You can do it down with whatever hand you can do it with. And you want to do it at every angle, up, down, diagonal, sideways, every way you can think of. Now, some of these are gonna be hard. As you can see, I'm struggling doing it in certain angles because you don't want to tweak your wrist. So if you have a partner that can do it for you, or another trans guy that you can work on each other, a friend that won't make it weird, something like that, to get that. And you can see that it is red. I know I'm really pasty. So it's hard to see, but you're just dragging along those scars, and this is, once you get used to it, you kind of used to you can throw off your shirt and be watching whatever on TV and just be dragging on your scars, right? So that's what you're doing. You're just kind of skin rolling. You're working on that area. And you do want it to look a little red. You by no means want to bruise it. That's too much, and you don't need to, just kind of pull through that. You do want it stinging a little bit. It's a little stingy, right? But that's the point. You're breaking down that tissue, especially on areas that are a little bit bigger, like I have some over here. That's really an area that you can just kind of, kind of work some blood into there. But yeah, the horse and buggy technique is what you would do on somebody else, right? And you can do it on yourself. It can be a little bit awkward, but especially if you are working on somebody else's scars and they're working on yours or whatever, you can drag across those scars, make it nice and bright red, as you can see. You could probably do this every day. I don't think you necessarily have to do that. You could do it once a week. I would probably keep your sessions to like 15-20 minutes, just so you don't want to, like I said, you don't want to over-bruise the tissue. You don't want to completely traumatize it. You're just breaking it down enough to kind of break up some of that scar tissue, bring the blood flow back to it so it'll heal in a less scarring manner. And this is not from my massage therapy, but I like vitamin E. I put lots of vitamin E on there, and I use essential oils. I looked up a scar treatment and I did that. So I made a little roller ball. You can buy the little roller ball things. and I'll just roll it right on there, you know. But anyway, that is the skin rolling technique for breaking down scars, and you can do that on any scar anywhere. Of course, that's not just for top surgery scars. So that's what you do. Like this, if you can see this elbow scar right here, it's kind of hard with the way I have my lighting going tonight, but I personally like this scar, so I don't give a shit. But if I didn't like it, if I wanted to reduce it, I could do it up and down, all the different ways that I could do without messing up my wrist or anything. But I hope that helps. And, you know, when I'm breaking it down, you want a little drag. You know, a lot of times when you're doing massage, you want a glide, right? So you'd use lotion or oil or whatever you prefer to make that glide. When it's coming to that technique, I want a grip. If you put too much lotion on, you're just going to slide off and you can't get that grip. So I would not recommend using any kind of lotion on there to do that. And put lotion on afterwards, that's a thing. But while you're doing that technique, I like the extra grip to really kind of roll through that skin, right? I mean, yeah. So hope that helps. Hope folks enjoyed this and you can work on that. And that's all for tonight. Love and peace, friends.